Good morning.
Good morning.
Welcome to the Senate Committee on Education, Health Professions Subcommittee. If the clerk would like to take the roll.
Senator Pekarsky?
Here.
Senator Head?
Here.
Senator Bagby?
Here.
Senator Pillion?
Here.
Senator Boysko?
Here.
You have a quorum, Madam Chair.
Thank you, Madam. Thank you, clerk. Well, we have a little bit of housekeeping today. My bill, SB 351, will go by for the day, as well as SB 682, Senator Suderline.
We need a motion.
We need a motion. Can we do them in a block? Can we do them in a block? Okay, do I have a motion to do them?
So moved.
All righty, all in favor of passing them by for the day? Aye. Any opposed? All righty, thank you so much. The motion passes. So first up, we have Senator Stewart, SB 331. Oh, he's not here. Do we have?
We have Hackworth.
Senator Hackworth. Thank you. I'm just going down the line. Oh, here's the sign-up sheet. Thank you, Senator Hackworth. Will you tell us about your bill?
Thank you, Madam Chair. Thank you, Madam Chair. Members of the committee, good morning.
Good morning.
Senate Bill 553, and I need to move this substitute, please.
Move the second. All in favor? Aye.
Okay, and what that substitute does is it changes from where the student lives to permit the nursing education program, the location of the nursing education program. It makes it a lot easier to track. But what this bill does, Madam Chair, is it is basically a tool that we can use to address Virginia's access to health care issues. Some of our region's largest hospitals are located in West Virginia, Tennessee, and North Carolina. And currently, the Virginia Board of Nursing allows no more than 30% of a nursing student's clinicals may be done outside of Virginia. So nursing students in my area of the state must seek a waiver to complete more than 30% of their clinical hours out of state. And, we already allow reciprocity for licensure for our nurses. They can go across and work in these states. So I think it's only fair to allow their training to be done in the same states that allow the reciprocity for them to be able to work once they get licensed. And that's what this bill does. It allows that waiver to where that they can take their out-of-state clinical without having to apply for that waiver.
Thank you, Senator Hackworth. Are there questions of the committee? Is there anyone in the audience who wishes to speak in favor of the bill?
I think so.
Please identify yourself and tell us who you're representing.
Ellen Davenport with the community college system. This positively impacts 4 of our community colleges that are on the border on other states. Especially, I'll point this out, Virginia Highlands, which is in Abington. Their students can go to Bristol Regional Medical Center for their clinicals in Bristol, Tennessee. Southwest Virginia Community College to Bluefield, West Virginia, the Princeton facility, Lithville Community College to the same facility in Bluefield. Also Northern Regional in North Carolina, Allegheny Memorial Hospital in Sparta, North Carolina, Ballot Health in Kingsport, Tennessee, and the National Healthcare Corporation in Murfreesboro, Tennessee, and Mountain Empire, which is in Big Stone Gap, to hospital system in Kingsport, Tennessee. So thank you very much.
Thank you so much. Are there other members of the audience?
Virginia Hospital Healthcare Association. We strongly support the bill. It's another important tool in our toolbox to address the workforce issues. And as Ms. Davenport just said, our hospitals from Life Point to Ballard to Carilion to Valley Health to Novo could all be in Centera, could all be affected by this and help them address their issues.
Thank you so much.
Madam Chair, Chris Nolan, for our Woods on behalf of Valley Health System in far southwest Virginia, upper eastern Tennessee, and we support the bill as well.
Thank you so much. Is there anyone in opposition to the bill?
Recommend reporting. Second.
Thank you. If the clerk would call the roll.
Senator Pekarsky? Aye. Senator Head? Aye. Senator Bagby? Aye. Senator Pillion?
Aye.
Senator Boysko?
Aye.
Ayes 5, no 0.
Your bill reports 5-0. Thank you.
Thank you, Madam Chair. Thank you, members.
Thank you. I have Senator Carol Foy has asked to go next. Is she here in the room? All righty. Senator Durant. And then would you like to tell us about your bill?
Yes, ma'am.
Thank you.
Good morning, Madam Chair, members of the committee.
Good morning.
I need to first move the substitute
All righty.
for Senate Bill 403.
Sure. Is there a motion to move the substitute? Second? All righty.
Okay.
All in favor? Aye.
Okay, so this legislation reflects a buy-in and work from various agencies, stakeholders, including Department of Behavioral Health and Developmental Services, DBHDS, Department of Medical Assistance Services, DMAS, Department of Health Professions, and we also solicited feedback support from the Virginia Association of Community Services Boards and Virginia Network of Private Providers. It also incorporates recommendations from the Claude Moore Foundation and the Board of Counseling's Regulatory Action Panel on Qualified Mental Health Professionals, otherwise known as QMHPs, and incorporates existing regulatory requirements and code. So the main difference between and this substitute is it maintains the QMHPs in the code and changes the name from behavioral health aide to behavioral health technician. Okay. So Virginia is experiencing a severe shortage, as many of us know, in behavioral health professionals, resulting in barriers to access treatment, disparities in outcomes, and suboptimal results. And there exists both an inefficient use of existing resources and an insufficient level of investment in training, education, partnerships, and data to actively facilitate the recruitment and retention of providers, leading to the inability to sustain the system as it is, and thus expand what the public behavioral health needs to be. So this very much is a workforce development bill. It's been really the genesis of many years of feedback that those stakeholders have been sharing, and I think that this is the product of at least 2 years of work on my end to get to this point. So this creates these credentials, stackable components for both the curriculum and for hours needed to reach the next level of certification for a behavioral health technician, assistant to behavioral health technician, and then on to become a qualified mental health professional. Once credentialed, the individual is qualified to provide collaborative behavioral health services under the direction and supervision of a licensed practitioner, and then these providers could then immediately start meeting the needs of behavioral health workforce and system better outcomes for Virginians. So we're really trying to bring those stackable credentials and build a pathway for students starting in high school with their degree to come in as a behavioral health technician assistant, and then once they get their 2-year degree, and then build up that career pathway for them. That is the goal that we're seeking for it. So I have several folks that I mentioned that are here to testify in support for this. And I think that it does, as I said before, reflect that buy-in from all of those agencies to what we're seeking to provide.
Thank you so much.
Madam Chair?
Yes, Senator Head.
Yeah, I noticed on the substitute in lines 84 through wherever that ends, 106, it looks like, when we're dealing with the definition of qualified mental health professional. On my bill, Senate Bill 155, which is dealing with workforce, the mental health community had asked us to consolidate mental health adult, qualified mental health professional adult, and qualified mental health child into one designation.
Yes.
And we've done that, and the language in that bill and the substitute for that bill is working through, which just is, I think, about to report out, changes that definition. I wonder if it would be a friendly amendment for us to put these in the same posture, so that if
Yes, sir.
we're well enough, if it's good enough for us to get both of these bills through, and I hope that we are, that it's not a race to see which one gets enrolled last.
It's-
Sen-
Yep,
Senator Durant.
Madam Chair, and Senator, I believe that, and I'm going to call in an audible to support, but I believe that is a reflection of what we were seeking to do in that one. I don't have oh, here we go. I've got this one. So can you tell me again the line number? and the substitute?
Line numbers 84 through 106, and if you compare that to Senate Bill 155, which is the exact same code section, in that particular case, it's line numbers 193 through 213,
Senator Durant.
211.
Yeah.
Senator Durant.
Yeah.
Speak through the chair, please.
Oh, sorry. Thank you, Madam Chair. If I may just seek to council to make sure that, yeah. But yeah, yes, Madam Chair, it would be a friendly amendment. I think that was the goal, that we get that in the same posture.
Then, Madam Chair, I would move that we make that amendment.
Second. All in favor? Aye.
Aye.
Any opposed? Okay, that amendment is adopted in concept, and when we reach the full committee, we can
Yeah,
make certain that that's finalized with help from the clerk.
yeah. Thank you very much, Madam Chair. Thank you, Senator.
Thank you. Senator Head, I think that's very important that this is intended to be all collaborative, and appreciate your agreement. Are there members of the body who wish to speak in support of your bill?
Yes.
And if they would come up, here they come.
Morning, members of the subcommittee, Madam Chair. My name is Dr. Alexis Aplaska. I serve as the Chief Clinical Officer for the Virginia Department of Behavioral Health. According to the 2023 Mental Health America report, Virginia is ranked 39th in the nation for mental health workforce availability. These mental health workforce shortages have significant impacts for individuals in need of treatment, and the disparity is worse for youth. In schools, we will never meet the recommended ratio of students to school counselors, social workers, and psychologists, and meanwhile, students and educators will continue to struggle. And the interventions and treatment needed in Virginia to address the mental health crisis occur on a continuum, from prevention, early intervention, to treatment, and maintaining recovery. And so this bill creates a mental health workforce pipeline that mirrors that continuum of services and supports in Virginia. A pathway that starts in high school to expose young people to careers in behavioral health. And as Senator Durant noted, it creates stackable credentials for behavioral health roles that can be attained through an associate's degree and then qualified mental health professional with a bachelor's education. That then can lead a person towards graduate education and licensure. The bill also provides a scope of practice for behavioral health technicians and qualified mental health professionals to provide clarity of role within a collaborative behavioral health team. It does not eliminate any existing mental health workers. It aims to expand pathways into the mental health workforce. And so whether you decide in high school or have a career change, we need everyone who wants to be a mental health worker in Virginia to have the opportunity, without necessarily going back to college, to change the major they decided when they were 18. Lastly, this bill will also direct the Board of Counseling to develop regulations alongside stakeholders to determine what didactics, such as ethics and training, is required, including what is needed to be a supervisor. So that specific in training, Virginia will increase the capacity and competency of the workforce. It is also noted in the governor's introduced budget, there is a proposed $1.2 million across the biennium to support the training and development of this particular workforce. So this is a prime opportunity to invest and expand the mental health workforce and close those gaps.
Thank you so much for your time. We're starting to run a little bit close on time, so if we could summarize your comments.
I'm Jamie Wilm, Executive Director for the Board of Counseling, and I'm here in support of the bill. The QMHP piece is something that the board has been working on to streamline with, at the request of the CSBs, and the bill reflects that.
Wonderful, thank you.
Good morning, Madam Chair. Jeff Lenardi, Chief Deputy at DMAS, the State Medicaid Agency. Just want to support the bill. Align my comments with the previous two speakers. And just point out specifically that the substitute both leaves the workforce intact for our current community mental health rehab services, and then also puts us on a timeline in lockstep with the redesign services that are envisioned in the governor's budget.
Excellent, thank you so much.
Good morning, Jennifer Gleason, representing the Virginia Association of Community Services Boards. Thank you for bringing in all of those stakeholders here in terms of the SMART program for this measure.
Thank you.
Jennifer Fitter, the Virginia Network of Private Providers and
Thank you so much. Are there members of the audience in opposition to this bill? Seeing none, do I have a move? All righty, if the clerk would call a roll.
Senator Pekarsky? Senator Head? Senator Bagby? Senator Pillion? Senator Boysko?
Aye.
Ayes 5, no 0.
The bill reports 5-0. Thank you so much,
Very
Senator
Madam Chair,
Durant.
members of the committee.
Next, we have Senator Carol Foy with SB 716. Senator Carol Foy, tell us about your bill.
Thank you, Madam Chair and members of the committee. Senate Bill 716, following the overturning of Roe v. Wade, states have now been hostile towards abortion and prohibited entirely both inside and outside their borders. As of September 2023, at least 16 states have enacted legislation to make abortion care heavily restricted. Physicians who provide abortions are struggling to navigate this new legal space. We don't have those same type of restrictions here in the Commonwealth of Virginia. What we need is to reject the power of other states to harm our providers and the patients who come to Virginia to access medical care, and we reject the power of Virginia's board to punish providers for actions that would be legal in Virginia but are deemed unlawful in other states. What this bill does is, first, this bill changes the current language from prohibiting criminal abortion to prohibiting abortion care that is specifically prohibited by the laws of the Commonwealth. Second, the bill prohibits the Board of Medicine from taking action against healthcare professionals for providing abortion care that is lawful under the Virginia Code, based on the alleged provision or receipt of human health services not prohibited under the laws of the Commonwealth, regardless of where such human health services were provided or received. Okay. And this means that a medical provider in Virginia who, for example, performs an abortion on a patient outside of the Commonwealth may be disciplined by the board in that state. However, the Virginia Board of Medicine will not be able to impose additional disciplinary measures for actions performed, so long as the procedure would have been legal in Virginia, even if said procedure goes against the laws of that other state. So I hope that the committee can. I would like to move the amendment in form of a substitute.
Thank you. Is there a motion? Second. All in favor of accepting the substitute? Aye. Any opposed? Ready. Senator Carol Foy, your bill is in the proper posture. Do you have anybody here who is in support of your bill?
Yes, we have several people in support.
Excellent. We're going to keep the
Can I
testimony.
ask a question real quick?
Senator Pillion.
So I asked council, why is this not in courts, the courts committee? Why is it before us?
Senator Carol Foy.
Oh, okay, thank you. You're awesome. Madam Chair?
Yes.
Senator Pillion, it's because the code section, it's a basic amendment, yes, that's correct. You got it.
Thank you. Senator Carol Foy, if you have testimony, I would like to keep it to 10 minutes on each side, maximum. Can you all keep the time for us? Yeah, it would be best if you come and sit in Senator Carol Foy's, so the public can hear.
Good morning. Thank you so much. My name is Rayanne Roca Pickett. I am the Communications Director for Planned Parenthood Advocates of Virginia. We are here in support of this bill. This bill aims to mitigate the risk of out-of-state enforcement against abortion providers in our state who provide care to patients from our state and elsewhere. It is critical that our lawmakers take every available opportunity to protect access to abortion for those in our state and for our neighbors forced to travel away from home to get necessary time-sensitive care. We are here in support of this bill. We are encouraged that our elected leaders are eager and determined to ensure that patients can safely access abortion. We hope to continue working with them to increase access to reproductive health care this legislative session and in years to come.
Thank you so much. Next speaker, please identify yourself and tell us who you're with.
Good morning. Good morning. My name is Galina Varchena. I'm the Policy Director for Birth and Color, and I would like to thank Senator Carol Foy for bringing this important bill forward. We're living in unprecedented times. The attacks on abortion care across the country are beyond anything we have seen in decades. We have providers being afraid to provide care. We have patients fleeing their states. So any step that we can take to protect care in Virginia and to ensure that our providers feel safe providing necessary reproductive health care is an important step forward. We sincerely hope that you report this bill. Thank you so much.
Thank you so much. Next speaker.
I will be brief. I'm Nicole Lauder. I'm here on behalf of the American College of Obstetricians and Gynecologists. And for the protections that the bill affords to OBGYNs who practice in Virginia, we support the bill, and thank you for your support.
Thank you. Next speaker.
Good morning, Brittany Whitley on behalf of the American College of Nurse Midwives, and we support the bill and thank the senator for bringing it.
Thank you so much. Senator Pillion, did you have a question?
Madam Chair, maybe a question. So are physicians not already awarded this provision without this D section? Are they not protected by the Board of Medicine for performing something that's legal in the Commonwealth now?
If the clerk could provide any feedback.
Madam Chair, so this new language would provide new protections to the code.
If it's not already, but if it's legal, it's not adding anything.
Yeah, so right now, if it's legal, Madam Chair, which it is, yes. So this protection wouldn't be adding anything in addition to what's already in the code.
Senator Pillion.
I understand the intent of the bill, Madam Chair, but is this bill even needed other than just doubling down on?
Senator Carol Foy, can you tell us why you brought the bill forward?
Yes, absolutely. Madam Chair, Senator Pillion, the bill does change code language as far as prohibiting criminal abortion, which is open to interpretation, to saying that it prohibits specifically abortion care that is prohibited by the laws of the Commonwealth, which is more explicit. Second, it tells the Board of Medicine that they cannot take action against a provider for providing care, whether that person is from in-state or out of state, because it's a licensure issue. And so we have seen times when people have traveled for abortion care and that other states are trying to punish or prevent that from happening. And what we make clear in this bill is that licenses of physicians cannot be threatened. Patients cannot be threatened for having access to abortion care that is legal currently in Virginia, but may not be legal in their home state.
Thank you, Senator Carol Foy. Are there members of the audience who are in opposition of this bill? Let's give you a chance. We have a total of 10 minutes available. Thank you. If you'd tell us who you are and who you represent, that'd be great.
Yes, good morning, Madam Chair. I am Olivia Turner, the president of the Virginia Society for Human Life, and I am here representing the women of Virginia, like myself, who have had abortions. I am concerned about bills like this that have been introduced this year because while we are supposedly in a frightening situation where we need to provide more legal protection to abortionists, we are leaving out women who might ultimately end up being the victims of bad actors who are allowed to come into the Commonwealth of Virginia, where we know we'll have no laws to provide protection to them, where abortionists are being provided protection and cover under laws that make it easier for them to operate in the version of a Kermit Gosnell in Philadelphia, who only a few years ago was not only killing unborn children, but their mothers. We do not want to become a place where, under the current circumstances, which are complicated enough already, that we open the door to those bad actors who would commit egregious acts against the women of Virginia. I want to make it also very clear that the Virginia Society of Human Life is one of 75 pro-life organizations nationally and statewide that signed a letter in 2002 that said under no circumstances have we ever, nor will we ever, pursue any criminal action against women who seek abortions here in our own state or throughout the country. Virginia Society of Human Life is committed to providing care to women and opportunities that respect them and their unborn children. We do not want to see Virginia creating a place where we open the doors to any bad actor who wants to behave in any manner that would ultimately put women like myself, who have been in a crisis pregnancy situation at greater risk. Whether they come from another state or they come to Virginia, we need to be aware that we must not be that place. And I thank you, Madam Chair, and members of the committee for listening, and I appreciate your saying no to this bill this year.
Thank you. Next. Identify yourself and who you're with, please.
Certainly. Good morning, I'm Susan Musket. I'm president of Pro Family Women, and we strongly oppose SB 716. This bill is not about protecting women. It is about protecting abortionists. It is the first step towards protecting abortionists who prescribe telemedicine abortions for women in life-affirming states. The key words are regardless of where such abortion care was provided or received. You see, traditionally, doctors must be licensed or authorized by the medical board of the state in which a patient is located. Otherwise, a state medical board can take disciplinary action for practicing without a license. This is because the state where the patient is located has the best means of protecting the safety and interests of the patient. That is why the Virginia Board of Medicine's telemedicine guidance states that, quote, the practice of medicine occurs where the patient is located, quote, and that, quote, practitioners who treat or prescribe through online service sites must possess appropriate licensure in all jurisdictions where patients receive care, end quote. But under a new novel theory, SB 716 shields abortionists in Virginia by shifting the locale of care from the home state of a woman receiving chemical abortion drugs to the home state, Virginia, of the abortionist, with the final words of the bill, regardless of where abortion care was provided or received. Under this bill, abortionists in Virginia will be able to perform surgical abortions on women from other states, prescribe and distribute abortion pills that women can take back to their home states, and most importantly, prescribe and mail abortion-inducing drugs to patients located in life-affirming states without being licensed in those states and not fear repercussions from the Virginia Board of Medicine. A second bill, SB 278, will provide further protections for abortionists by protecting them from being subpoenaed or extradited to another state because they have violated that state's law. Please oppose SB 716.
Thank you for your comment. If you could let us know how much time we have used up so we know what is remaining.
We have about 5 minutes and 45 seconds left.
Thank
Madam
you.
Chair.
All righty, if you would introduce yourself and tell us who you're with. Thanks.
Yes, thank you, Madam Chair, members of the subcommittee. Jeff Caruso with the Virginia Catholic Conference. Thank you for the opportunity to speak. I will be brief. On the one hand, we are against prosecuting or criminalizing women who have had abortions. On the other hand, when you place a protective shield around abortion providers, as this bill would do, what you're really telling the people of Virginia, or people from out of state rather, in our view, is that if you want to obtain or provide an abortion, come to Virginia. And we are not clear on why we would be giving abortion a unique or exclusive status in Virginia law. We think that would be bad policy. Why would something that ends lives be given an elevated status? So rather than advancing this bill, what we would urge this committee to do instead would be to seek laws that protect mothers and their children from the tragedy of abortion. Thank you.
Thank you. And our final speaker, if you'd come forward and tell us who you're with.
Thank you, Madam Chairman, members of the committee. I'm Daniel Davies, representing the Family Foundation, and we, for many of the reasons expressed by the last few speakers, we also oppose this bill and urge you to vote no to protect women and children here in the Commonwealth of Virginia from the bad actors, as was mentioned previously. Thank you very much.
Thank you for your time. Senator Carol Foy, are there questions for the patron? Hearing none. You have the last word.
Yes, thank you, Madam Chair. Again, this bill is needed and necessary as we have other surrounding states and other jurisdictions who are threatening and actually attempting to take the license of practicing doctors who perform abortion care. This bill simply says that in Virginia, if you're licensed in Virginia and you perform something that's legal, your license is not in threat, if the person comes out of state to have an abortion, your license in Virginia, if your license is not in threat, it makes it very clear across the board. We are very proud to be one of the last southern states to have bodily autonomy and allow pregnant people to decide when, if, and how to start a family. And this will go so far to ensuring that we protect providers and protect patients at the same time. I hope it's the will of the committee to report the bill.
Thank you so much. Do I hear a motion?
Move to report.
Second. All righty, all in favor? If the clerk would call the roll. Thank you.
Senator Pekarsky? Aye. Senator Head?
No.
Senator Bagby? Aye. Senator Pillion? No. Senator Boysko?
Aye.
Ayes 3, noes 2.
Your bill reports 3-2. Thank you so much. Appreciate it. We'll move on to the full committee. Senator Stewart.
Morning, Madam Chair.
Good morning.
Members of the committee. I've got Senate Bill 331. Not yet. Thank you. But yeah, hold that because we might need it. Madam Chair, members of the committee, this bill essentially, and I'll try to paraphrase, would require a physician to obtain informed consent prior to conducting a hysterectomy or an oophorectomy. I'm sorry, I don't know how to pronounce that because I'm not a doctor. And to explain to the patient the risks and what might occur, and to make sure that they understand it. And that really is the basis of the bill. And I know we think that physicians do that oftentimes, but I'm not sure that maybe they do or that patients understand where they're going. And my constituent, Ms. Collins, actually had a procedure some time ago that was unrelated to that. But while they were in there, they determined it would be in her best interest to remove her last ovary. She didn't understand that was going to happen. That really wasn't the plan. The doctor acknowledged that, but the doctor said that he determined it was in her best interest. And so it's created a great deal of difficulty for her. It's put her in what they call surgically induced menopause. And I get that professionals have to make judgment calls along the way, but the doctor in this case admitted that it was not a life-threatening situation. He just determined essentially that it was expedient to do it while she was under the knife. So I think this is a reasonable measure. As professionals, we all have to, a lawyer, I mean, I explain everything to a client before they go in the courtroom. They have to make certain decisions in order for me to be able to do my job. And I wouldn't do it unless I explained everything to them and I was certain that they understood it. And so I'm happy to try to answer questions, but Madam Chair, if you would, I would very appreciate if you would allow my constituent to testify and tell you all what happened to her.
Senator Stewart, we'd be happy to have her come up.
Thank you.
Thank you. If you might introduce yourself, please. Thank you so much.
Good morning, Madam Chair. I'm Karen Collins. Point of clarification, how many minutes do I have? Just
Sure.
I'll try to make it brief, but there's...
Yeah, I think 5 minutes.
Okay. I can do that. Okay. Good morning. My name is Karen Collins. I reside in Caroline County. I emailed each of you on January 12th expressing my support of Senate Bill 331, providing some background information on my personal experience, as well as a link to an investigative report regarding a Chesapeake gynecologist named Dr. Perez. If you're not familiar with that case, I hope you take the time to view that. Although lengthy, it is very enlightening and a perfect example of why we need legislative reform. My doctor removed my only remaining and fully functioning ovary during what was supposed to be a simple elective appendectomy. Its removal immediately rendered me sterile, stripping me of my possibility of ever having another biological child and thrusting me into surgically induced menopause at the age of 37. An oophorectomy wasn't on my consent form, it wasn't something I discussed with my doctor, and nothing in my medical record or the pathology report justified its removal. My doctor took something from my body without my permission, betrayed my trust, and violated his oath. What he did was wrong. It shouldn't have happened, yet it did. And though there was nothing I could do to get my ovary back, I took that misplaced trust and put it in our judicial system, hopeful that he would at least be accountable for his actions. Much to my dismay, I found that it's extremely difficult to find lawyers willing to take medical malpractice cases. And although I found representation, it wasn't before being told that it was just an ovary and that what happened to me wasn't traumatic enough to win a court case. One said that since I was 37 and already had children, a jury likely wouldn't sympathize with me. How is any of that relevant? Ovaries are critical to women's health and overall quality of life, and they serve so many functions beyond reproduction and continue to serve those well beyond childbearing years. Sadly, when my case went to trial last year, the jury found in the doctor's favor, and his defense was that he didn't need my written consent for an oophorectomy because the fine print of my consent form stated that during the course of the surgery, unforeseen conditions could arise requiring additional procedures, and that I authorized him to perform those if he deemed them necessary. In the months since that verdict, I have found numerous cases and countless testimonies online from women all over the country that have undergone similar circumstances. However, the most relevant is the Dr. Perez case here in Virginia. It highlights the flaws in our current system and how it has been failing women for decades. It also highlights the difficulties women face when they seek justice, from not being taken seriously to the inability to find or afford legal help, and the brick walls encountered when they file complaints with the medical board. This was just one doctor with hundreds of victims. The complaints that were filed over the years by his patients fell on deaf ears, and it wasn't until a nurse reported him to the federal government that he was held accountable. Without that nurse speaking up, he would still be harming women today. There is so much troubling data out there that I wasn't aware of until it happened to me. There's about 600,000 hysterectomies performed annually. It's a multi-billion-dollar industry. And although studies vary, some reports claim as much as 90% are either completely unnecessary or performed for benign conditions that could have been treated less invasively. Furthermore, reports indicate that minority and women in economically disadvantaged populations undergo more hysterectomies than others. There is less data and trend analysis for the approximate 200,000 oophorectomies performed annually, but there is a considerable amount of information regarding the effects of both those surgeries out there. Sadly, outside of the reproductive effects, much of that information is not passed on to patients during conversations with doctors, and it leaves them blindsided by what actually happens to their bodies. While I'm certainly not a proponent of the government interfering with medical decisions, women are in desperate need of legislation to protect them from unnecessary surgeries. Doctors should not be allowed to hide behind boilerplate fine print on consent forms. They should not have free rein on women's bodies based on what they deem to be in their best interest. The best interest for every woman is that she be afforded the opportunity to make her own decisions about what happens to her reproductive organs. Those decisions need to be informed and they need to be in writing with no gray area. The only exception should be life-threatening circumstances. These requirements would also provide much-needed legal standing for women when it does happen. And while they may be a minor administrative inconvenience for doctors, it is a small sacrifice to make to provide women the reproductive rights and bodily autonomy they deserve. I have a 10-year-old daughter, and I would never want her to be told that it was just her ovary.
Yeah, thank you. I'm so sorry that that happened to you. That I'm sure. I appreciate you being willing to come up and tell us your story. That was very brave of you, and I appreciate your time.
Thank you. I appreciate your time as well.
Thank you. Are there other people in the audience who are in support of this legislation? Are there people in the audience who are in opposition of the legislation? If you could tell us who you're with and introduce yourself if you want to come.
Sure. Madam Chairman, Scott Johnson on behalf of the Medical Society. I appreciate Senator Stewart's time. He's devoted a whole lot of time to talking with us on this. In general, we don't like to codify standard of care in the code, and we had talked with him about an approach of having the Board of Medicine look at this to see if any of the regulations may need to be addressed or not on that. And if y'all were amenable to that, and he was, then we would be fine with that, and glad to answer any questions if you have them.
Thank you very much. Are there questions? Nicole, are you coming up too?
Nicole Lauder on behalf of the Virginia section of obstetricians and gynecologists. I'll just echo what Mr. Johnson said. We would be amenable to the board looking at the regulations. We're very sorry for the experience of his constituent. It's unfortunate, and we hope that it's just a one-off situation and not the common practice, but we'd be happy to have everyone look at the regulations and see what needs to be done.
Okay, thank you very much. Are there questions from the, all right, Senator Stewart, did you have a possible amendment or substitute? Okay.
And
Would you
I'm gonna
like
leave-
to?
I'm going to leave that up to the committee.
Okay.
We'll see the substitute.
Yeah, if we could, would the clerk be able to read what the substitute says? Pass it out.
Yes, Madam Chair. The substitute reads that the Department of Health Professions shall, in consultation with the Board of Medicine, review the informed consent requirements surrounding a physician who recommends or performs a hysterectomy or an oophorectomy, and determine if any regulations are needed regarding the educational information that is provided to a patient as a part of the informed consent process in advance of undergoing such surgeries. The Department of Health Professions shall report its findings and recommendations to the Chairman of the House Committee on Health and Human Services and the Senate Committee on Education and Health by November 1st, 2024.
Is there a motion to accept the substitute? Second.
It's up to y'all. If you all want to go with the substitute, we're fine with that, or if you want to stay with the same bill, whatever the committee thinks. At least the substitute's a start.
And if, Madam Chair, I would just tell the senator and his constituent, if we get this back in November and that's not satisfactory, then we'll see you next year.
So I have a motion and a second. All in favor of accepting the substitute, say aye. Aye. Any opposed? Senator Stewart, your substitute is in front of us. Do you want to have any final remarks?
I think my constituent did a better job than I could ever do.
I agree.
Senator, I think she was really compelling. I appreciate her willingness and bravery to come and tell her personal story. It does make a difference to hear directly from the person who has been directly affected, and I know that that was difficult for you. And we appreciate you and Senator Stewart for bringing this forward. If the clerk would call, if I have a motion to, do we have a motion to approve the bill?
So moved. Second.
Thank you. If the clerk would call the roll.
Senator Pekarsky? Senator Head? Senator Bagby? Senator Pillion? Senator Boysko?
Aye.
Ayes 5, no 0.
Your bill recommended for reporting 5-0. Thank you,
Madam Chair,
full
members
committee.
of the committee.
Thank you very much.
Madam Chair, there should be a substitute that is available, which is a result of stakeholder input to reach consensus on Senate Bill 614.
Okay.
And I believe that our expert legal team will tell us that as a result of these changes, the bill likely needs to be re-referred to courts.
Do I have a motion to accept the substitute?
Also move.
Second.
All righty, all in favor of accepting the substitute? Aye. Aye. Any opposed?
And I'd make the motion to re-refer this to courts.
Is there a second?
Second.
All righty, all, if the clerk, do you need to call the roll, or? Okay, do we need a voice vote for this, or can we? All righty. Aye.
That works.
All in favor? Aye. Okay, the clerk reports that this will be re-referred to judiciary, and seeing no other business before the committee, the committee will rise. Thank you all.